speaker, Ms. LaKishia Brown. She is a distinguished expert in the field of health education and promotion, bringing over 15 years of experience in her work. She holds a Master's of Arts in Health Education and Promotion from East Carolina University, where she also earned a certificate in Professional and Technical Communications. Ms. LaKishia has a proven track record in developing and implementing comprehensive well-being programs that enhance employee health and engagement on a global scale. So with that, I'd like to thank you for your time once again and turn it over to you, Ms. LaKishia.
Thank you. Thank you. Good afternoon, everyone, and welcome to today's session on patient communication and empathy. I'm really excited to be here with you all as we explore two of the most crucial elements in healthcare, which is effective communication and empathy. So as future healthcare workers, your technical knowledge is, of course, critical, but beyond knowing the medical facts, it's just as important to understand how to connect with patients on a human level. So a lot of the studies that we see show that patients feel heard and respected and understood in their healthcare providers and their team members. They are more likely to trust the medical advice and follow the treatment plans that are outlined for them. So our goal today is to equip you with practical skills and to develop those skills so that when you step into your roles as healthcare professionals, you're not only ready to complete your task or treat diseases, but to also care for the person behind the diagnosis.
Ms. LaKishia, your presentation looks zoomed in on my end. I don't know if anyone else. Oh, much better. Thank you.
Okay. Sorry, I don't know what happened there. All right, can you see this slide?
Yep, I can see it now.
Oh, perfect. All right, so just as Janie introduced, I do have a background in health education and promotion. I'm a certified health education specialist with 15 years in the health and wellness field. And I'm also the founder of Living Matters, which is a business that specializes in managing population health for organizations, companies, communities, and even individuals. So I personally have a passion for helping others achieve optimal health outcomes. And I'm hoping that you would feel empowered in today's session. So let's just go ahead and dive in. We're going to start with an overview of what we'll cover. So we're going to focus on three key skills: active listening, patient-centered care, and building trust. Together, these skills form the foundation of strong patient-provider relationships. So whether you're in a clinical, a hospital, or any type of healthcare setting, how you communicate and express empathy will impact your patient's experience and healthcare journey. So first, we'll look at the importance of communication and empathy in healthcare. Then we'll break down key skills such as active listening, building trust, and we'll move on to review communication barriers. And then we'll end with a quick discussion on what I consider the goal of healthcare, which is patient-centered care. And by the end of the session, you should have that like solid foundation and knowledge to develop in these essential competencies. Okay, so communication is a core skill for any healthcare professional. But let's really look at why it's important for healthcare. First, one of the biggest reasons is that communication failures contribute to medical errors. In fact, medical errors often occur when there's a breakdown in communication between patients and providers or between members of the healthcare team. And so this can have those serious consequences. We also see that effective communication enhances patient satisfaction and adherence to their treatment plans. So when patients understand what's going on and they feel like they're actually part of the conversation, they're more likely to stay engaged with their care. And then we also see that strong communication builds relationships and fosters that trust between providers and patients. And this is especially important because when patients trust their healthcare provider, they're more likely to open up about any of their concerns, and they're more likely to engage in honest dialogue, which leads to better care overall. So here I just wanted to share some quick statistics that highlight the impacts of communication failures. So you see 53% of communication failures. In 2022, a review of medical malpractice claims found that nearly half, 49%, of claims involved a communication failure. And 53% of these occur between patients and their providers. So this just shows how critical clear communication is in preventing those errors. We also see that $1.7 billion communication failures resulted in 1.7 billion in malpractice. And this is almost 2,000 preventable deaths as well. So these are staggering numbers that reflect the heavy cost of poor communication in the healthcare system. And then one last statistic, 80% of serious medical errors. A study by the Joint Commission found that 80% of serious medical errors were the result of miscommunication between patients during that handover. So this highlights how it's not just with the patients, it's also between healthcare professionals during that transition in care or during that handoff. Now, these stats underscore the clear, consistent communication is not just a soft skill, it's an essential skill. It's a key component in providing safe, effective, and compassionate care. Now, there are several key elements of effective communication in healthcare. And each of these plays an important role in how we connect with patients and deliver information clearly and compassionately. First, we have clear and concise messaging. And this just means when we speak to patients, we need to be straightforward and avoid overcomplicating things. Medical terminology and jargon can be very confusing for someone who's not used to it. And it's important to explain things in simple, clear language that's easy for patients to understand. Now, we talked about active listening earlier, and we're going to spend a lot of time on this because it goes just beyond hearing the patient's words. Active listening really means fully concentrating, understanding and responding and remembering. That's the key, remembering what the patient is saying. It involves listening without any interruptions and really being present, fully present in the conversation. So this can help us catch important details, and it definitely demonstrates that when we value the patient's input, we value their story. So we want to make sure that they feel like we're paying them attention when we're engaging with them. Then we have empathy and emotional intelligence. And empathy is the ability to understand and share the feelings of another person, while emotional intelligence involves recognizing and managing your own emotions and those of the others around you. So, together, these two skills help healthcare professionals respond to patients in a way that is compassionate and emotionally supportive. And this is essential when we're trying to create that trusting environment. And finally, we can't forget the importance of nonverbal communication. This is the things like body language and eye contact. Those nonverbal cues often communicate more than words alone. A patient can tell if you're really paying them attention just by the way you're sitting in your seat or if you're making direct eye contact with them. So positive nonverbal communication can look like nodding and smiling when they're speaking. And this can make the patients feel more comfortable and understood. So mastering these elements can significantly improve the quality of interactions that we have with the people around us and more specifically the patients. And this leads to better understanding, building those stronger relationships and improved health outcomes when you're talking about patients. All right, so One of the most critical skills in healthcare is that active listening. But what does that really mean? What does that really look like? So we learned that active listening is more than just hearing and just more than just words. It's about really being fully present and engaged in the conversations. It does require us to focus our attention entirely on the patient to truly understand their message, and then to respond thoughtfully and meaningfully. And by doing so, we can ensure the patient feels heard, understood, and valued. Active listening also includes those nonverbal skills that we talked about, maintaining eye contact, nodding, providing affirmations through our body language. These small gestures signal to the patient that we're paying attention, we're paying close attention, and that their words are important, and that we'll discuss a little bit later how nonverbal cues play out in dialogue and how you can ensure that your body is speaking the right language. An essential technique with active listening is paraphrasing. So by reflecting back what the patient has said in our own words, we can clearly mis clarify any misunderstandings. We can confirm that we've grasped all of the key points that they're trying to make, and we want to make sure that we get the information accurately. That's the most important thing. So, what this may sound like in an actual setting is a patient is explaining their symptoms. And so you might say, well, what I'm hearing is the pain has worsened over the last week and it's affecting your sleep. Is that correct? Just this simple practice shows that we are invested in what the patient is saying, and it strengthens their relationship. And it's helping build that trust that's so critical in healthcare. So, the most important thing is you need to remember that active listening is not just about what's being said, it's how we respond. So it's important to avoid those distractions like checking your phone or even thinking ahead about how you're going to respond, because this allows you to stay fully focused on the patient. And when you think about conversations and interactions, a lot of times you may find yourself preparing for a response while someone else is talking, and that in itself can be an interruption. Maybe it's not physically there yet because they haven't heard it, but your mind is already in another place and it needs to be on the patient at that time. So try to avoid those interruptions and give the conversation your undivided attention, and these skills can greatly reduce those misunderstandings and create that more meaningful relationship. So the thing here is it's not just about gathering the information, but it's about showing the patient that you're there for them emotionally and professionally. So there are mutual benefits to active listening, and it's good on both parties because it benefits the person speaking by helping to ensure that they're actually being heard, but it also benefits the listener. Learning to put distractions and any judgments, whether well intended or not, putting those aside would not only prevent you from missing those important details, but it also helps teach you how to tune out unnecessary instructions or interruptions while focusing on important tasks. So we're going to practice a little bit now. And I want you to practice incorporating some of these phases into conversations. It's a great way to get started. So when someone is speaking to you, just keep these in mind if you feel your attention starting to drift, or a notification appears on your phone, or you're beginning to think ahead about what you're going to say. Come back to your mental inventory, and use these phrases to help demonstrate and execute active listening. So one of the biggest phrases that pops out to me is, "Do you mean?" And sometimes it seems like when we're conversing that there's just one long game of telephone, right? Even if we interpreted something one way, the person who said it may have meant it completely different. So that's why it's important to make sure you're getting the full story from the person you're listening to and understanding it correctly. So by asking for clarification, you're not just encouraging more details from someone who might be timid. about bringing something up, but you're making sure you've actually heard them and heard a statement as it was intended. Some alternatives to this is, I'm not sure I understand. Could you tell me more about that? Um, Another phrase I like is, it sounds like. And this phrase is something that helps provide clarification by demonstrating again that you're empathetic. But you have to be careful with this one because you don't want them to feel like you're telling them how they feel, but rather you're paraphrasing it as an expression of how you interpret their emotions. Some people have a tough time admitting when they're upset about something or they don't feel comfortable, or maybe they're not understanding what's coming, what you're saying in terms of healthcare and that jargon. So you also have to be good at reading what's not being said in the conversation. Again, those nonverbal cues, watching their body language. So people who excel at active listening are very good at reading what's not being said, and then also being really present in the conversation and paraphrasing. You can also say something like, what I'm hearing is, or you seem a bit, when you notice some of those nonverbal cues, you seem a little bit uncomfortable with that statement, or you seem like you don't really understand what I'm saying, and then you can just clarify. Another one that's really easy is just really, 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 why? And this phrase is one that helps to demonstrate encouragement into the conversation. It reminds the person that's speaking that you're paying attention. You're encouraging them to elaborate on something they said to you. And you can even replace the why with how, or when, or where. And this is just constantly checking in. Um, One that's not on the screen that I really like is, I've noticed that. And this shows that you're probably been in interaction with this person several times now. They're a regular. And so it shows that you're paying attention each time you're engaging with them. So by pointing out your observations about someone's behavior or their tendencies while they're speaking, you're not fully absorbing the words. So you want to wait until afterwards, and then make sure that you're taking in those nonverbal cues. To put it in practice, it may sound like, I've been noticing that when we talk about your blood pressure, you seem a little worried. Um, Let me make you a little more comfortable in the direction that we're going. Let me take it again. Let's relax. Let's take a couple deep breaths and then I'll recheck it. It's checking in, and it's saying, hey, I notice, I'm aware of how you're interacting and how you're moving. So let's talk about it, and let's see what we can do together. It's bringing them into their own care now. Another phrase on the screen, let me make sure I've got this right. Again, this is checking in with your counterpart to summarize what you've heard them say. So by repeating it back to them, you're listening, you're demonstrating, and you're ensuring that you understand what the person means. Okay. I think the biggest takeaway here is to listen carefully. There are going to be times when you've got enough on your plate, or there's always a deadline or somewhere that you need to be. And it can be hard to pay attention, especially when you have this long to-do list that's probably occupying your mental energy. But as we've mentioned several times, active listening doesn't just benefit your conversational counterpart, the patient. You stand to gain from it as well, from making sure you don't miss out any important information or any details, to exercise and focus on an important task and putting these phrases into practice. You want to make sure that you're becoming more proactive and an empathetic listener. Now let's talk about empathy. So empathy is not just about being kind. It helps the patient feel supported and cared for. And when patients feel that we understand their situation, it reduces their anxiety. And this emotional connection is very important. when we're working with patients, especially the same ones over and over again. In healthcare, empathy specifically is not just a desirable quality, it's an essential skill that significantly impacts the overall care and outcome for that patient. So, in this context, empathy is the ability to understand and connect with the patient's emotions, their experience, and their perspectives. So, it goes beyond feeling sorry for someone. Instead, it's about stepping into that patient's shoes, seeing the situation through their eyes and responding in a way that truly reflects understanding. So when healthcare workers practice empathy, you know, it's going to enhance communication and also patient satisfaction. But empathy isn't just beneficial for the patient, just like active listening. It helps your providers, the professionals, you make better decisions because now you have a clear understanding of the patient's needs because you put yourself in their shoes, right? So let's break this down a little further. Imagine that there's a patient that's really anxious about a diagnosis. An empathetic response from a healthcare professional would involve not just acknowledging the patient's fear, but also offering some reassurance in any information that you can to address their concerns. So you might say something like, "I can see that you're feeling anxious," and that's completely understandable. Let me walk you through what this treatment means or what this diagnosis means, and we'll take the next steps together. This simple response just lets the patient know that I hear you, I see your worry, and I'm here to help. But it's not just about those comforting words. It's also about how we behave in that room with the patient or in their presence. Those nonverbal cues, again, the eye contact, the body language, the tone of your voice, it plays a huge role in conveying empathy. You want them to see it and feel it. So a soft tone, a reassuring nod, again, that's the verbal cues, not just sitting at or standing up above them, but sitting at an eye level with the patient. These are things that can make them feel comfortable in the space and understood. When patients sense that their healthcare professional or provider truly understands what they're going through, it's going to encourage them to open up more about their symptoms, any fears or concerns that they may have. So I want you to take a moment and just pause because we're going to think about empathy in our own lives. And I want you to reflect on a personal experience. Think about when you felt misunderstood. And it could be in a personal or professional setting, but I just really want you to think about how being misunderstood made you feel. And if you can, just put it in the chat, any feelings or emotions that you experience. I just want to see what we come up with here. Just put one word, one emotion that you may have experienced in any type of situation where you were misunderstood. Anxious. Yes, Laura. Anxious. That's a good one. Frustrated. Absolutely. Angry. Dismissed. Hurt. Hurt even. Disappointed. I see disappointed a lot. Absolutely. Imagine that you're that patient now. Oops, sorry. And you're the provider. You're that worker that's engaging with them, and this is how they're feeling. You knowing how it feels to be misunderstood, disappointed, unimportant, really good, Terry. You don't want to be the cause of this emotion and this feeling for a patient. So now imagine if the person that you were engaging with who misunderstood you, what if they had taken the time to really listen and understand what you were trying to convey? Think about how that may have changed the outcome of that interaction. I want you to keep this exercise in mind. It's important because it helps us appreciate how powerful empathy can be in building connections with your healthcare provider or anybody around you, your teammates, your colleagues, your peers. It's going to help build that connection and that trust, because a lot of times when we feel these emotions, these strong emotions, we build that wall. We cannot afford for that to happen in healthcare with a patient. Okay. So I just want you to remember this moment. Remember how you felt being misunderstood, and then remember that patients are already feeling vulnerable. And so they need that feeling to be understood with their providers and their teammates. And it reminds us as future healthcare professionals that the empathy you provide and you give will shape not only your relationship with your patients, but also the quality of care that you provide as a professional. By consistently exercising empathy, we remind ourselves that every patient has a unique story. They have some type of emotional context and a different perspective. And when we really take the time to acknowledge that, we create that stronger, more compassionate connection, because we want to impact the patient's experience and their overall well-being. All right. Now, empathy, as we said before, is often seen as something that we're born with, a soft skill, but it's actually a skill that we can develop. Strategies like active listening, self-reflection, mindfulness, these things can help nurture empathy. So think about emotional intelligence. This is the ability to recognize and understand and manage your emotions and the emotions of others around you. So developing this emotional awareness is going to allow us to respond to patients in a more compassionate and empathetic way. So let's look at some of those strategies right now. The first one, listen without judgment. This is the foundation of empathy. When we listen without making assumptions or passing judgment, we create a safe space for the patients to express themselves honestly and openly. It is about listening with the intent to understand and not just respond. We talked about that earlier. Second, validate the patient's feelings. Acknowledge their emotions, acknowledge them, whether it's fear, frustration, sadness. It can be incredibly powerful to say, I understand, I hear your frustration, I sense your sadness. When a patient is feeling their emotions are being validated, then you're starting to build that trust, and that they're starting to feel now understood and sometimes validated in how they're feeling. The third thing you want to do is use compassionate language. The words we choose matter. Using kind, patient-centered language, it shows that you care about the patient's well-being. Even the small shifts in how we phrase things can convey a deep sense of empathy and support. And lastly, acknowledge the emotional impacts of the illness. Illness isn't just a physical experience. It can affect every aspect of a patient's life or a person's life, their mental, their emotional, their financial health. So recognize this and address it in your own conversations. This is going to show that you see the patient as a whole person, not just a set of symptoms. Now let's consider the outcomes of practicing these strategies. What you're going to get in return, better emotional support for patients. We said it several times, when they feel like they're listened to and understood, and they're more likely to feel emotionally supported through their healthcare journey. That's building relationships, that's building that trust. They'll see reduced anxiety and enhanced therapeutic outcomes. Empathy helps calm the patient's anxieties, and this can improve their experience. and even contribute to better clinical outcomes. Then you're going to see patients feel understood and supported. Their emotions are validated. You're using those compassionate language, and we create a safe environment where patients feel truly seen and heard. Now, we spoke on this. It improves that provider-patient relationship, that strong bond and trust between the provider and the patient. And a lot of times this leads to a more collaborative approach to care. You also see that increased comfort. I'm not sure what's going on here. Sorry about that. And this is reducing that patient anxiety, naturally increases their comfort when it's a stressful time. It's something that maybe they're experiencing for the first time. So you want to make sure that you're putting these skills and these techniques and strategies at the forefront of your care. Okay. So nonverbal communication, we spoke on this already. Our body language, the facial expressions, the tones that I mentioned, they all convey meaning. For example, crossing your arms. This might make you seem a little more closed off while maintaining open body language. And that signals that you're approachable, you're ready to listening. Similarly, the tone of your voice can indicate whether you're being empathetic or dismissive. So be mindful of these cues as they play a significant role in how the patients perceive you. This type of nonverbal communication is crucial in how we interact with our patients. So now let's just explore how nonverbal cues impact the quality of care. First, consider the importance of body language, your facial expressions, and your tone of voice. This is important to be aware of our physical presence and how that affects the communication that takes place in a room. Next, we want to make sure that our nonverbal communication must align with what we're saying. So if you're telling a person or a patient that you're going to be okay, your facial expressions, looks of uncertain or worried, they're going to pick up on that. And it might undermine the confidence in your care. And lastly, we want to be observant of the patient's nonverbal cues as well. A patient may say they're fine, but their body language, they're avoiding eye contact, they're tensing up. This could tell you a completely different story. So you want to make sure that your observations and your interpretation of cues, all these things are really important because it really allows you to understand their true feelings and address any underlying concerns that they may be reluctant to even express or validate verbally. Effective non-verbal communication is about being intentional in our actions, ensuring consistency between our words and our body language, but also being perceptive to everything that's around us in that room with the patient. When we master this skill, we're not only enhancing communication, but remember, it goes back to building the trust that's so necessary in patient-provider relationships. All right, so research has shown that nonverbal communication represents over 55% of all communication. That says a lot. The conversations and interactions we have with patients not only include what we say or how we say it, but what we're doing in their patients, in their presence. Now let's look at how we naturally communicate nonverbally. We spoke on this, eye contact. Are you looking directly into the person's eyes during the communication? This plays a key role in conveying attention, sincerity, engagement. And in healthcare, appropriate eye contact demonstrates active listening. And it definitely shows that empathy. But it should be a balance to make sure that you're not making the patient uncomfortable. You don't want to stare, but you definitely want to look in their direction when they're speaking. Hand gestures. And this is the movement of the hands or arms that can complete or emphasize spoken words. And in communication, it helps us clarify meaning and express emotions, like pointing in a direction or open palms sometimes signify honesty. And remember, those crossed arms is sometimes mistaken as defensiveness. So just make sure that you're monitoring your hand gestures because it can be used to explain treatments and reassure patients, but it can also come off as aggressive if it's overused. Facial expressions, and these are just the movements in our face. Sometimes we can't help what our faces look like, but make sure you're being mindful because you want to convey the emotions of happiness. And you want to make sure that your face matches the tone of that room and that environment. Be careful about sadness, anger, or even surprise. They play a critical role in showing empathy. So a warm smile or a concerned look can provide comfort to a patient because now you're matching their energy. Um, a neutral negative expression, it's going to be showing disinterest or even judgment. So just be careful how you approach your patients with your facial expressions. Physical touch, and we have to be careful with this, but it refers to any type of intentional contact, like a handshake or a pat on the shoulder or holding a patient's hand. It can communicate comfort, care, and empathy, but it has to be appropriate, gentle physical touch to provide reassurance. And make sure that you're carefully respecting the personal boundaries and cultural sensitivities. So just be careful with physical touch. Posture. Posture is the position and alignment of the body during your interactions. And this is going to show your attentiveness, your openness, or disengagement. Open, relaxed posture, sitting upright with your shoulders back. This signals attentiveness and readiness to listen. Whereas if you're slouched and your arms are crossed, that posture may indicate defensiveness, boredom, or even lack of interest. Tone. Be careful with your pitch, your volume, and emotional quality of a person's voice when speaking. It can alter a lot of times the meanings of the words and affects how the message is being received. Gentle tone, soothing. Stay away from harsh or rushed tones because that can also cause anxiety and sometimes make the patients feel dismissed. All right. So when it comes to communication, especially in healthcare, um, there are several barriers that make it challenging for both patients and providers to connect with one another. And so we're just going to touch on these for a few minutes. But first, we're going to talk about boundaries, like barrier of time. In a fast-paced environment like healthcare, time is limited. We understand that. We see that often. And this lack of time, it can lead to rushed conversations and it makes it difficult for the patients to fully express their concerns and get in time to say, hey, well, wait a minute, what about this? So we want to make sure that we build in time to listen and respond thoughtfully. And it is important, you can acknowledge those time constraints early on in the communication, but still prioritize meaningful quality communication. Assumptions. So this is when we think we know what someone is going to say or how they feel without using those active listening skills or asking for clarification. A lot of times this leads to the misunderstandings, missed details, and those medical errors that I mentioned earlier on. This is extremely problematic. Accuracy is crucial. So we want to remove assumptions from any of our interactions with patients. Ask those clarifying questions and make sure that you fully understand the patient's perspective. Cultural differences. And this is really another presentation on its own, but this is a huge significant barrier. People come from diverse cultural backgrounds, and a lot of time this influences how they communicate, how they express emotions, or even interpret certain words or gestures. Remember, I talked about the hand gestures in your body language. And so these misunderstandings can easily arise when cultural differences are not considered. So, to overcome this barrier, it's important to be culturally sensitive, open minded, and do your research. Do your research to adapt your communication styles to make sure you're meeting the diverse needs of your patients. And lastly, there's emotional overload. Healthcare situations are time consuming, high stress, emotionally charged for the patients and the providers or anyone involved in that team of care. So when emotions are running high, it can be difficult to process information. Listen attentively and respond appropriately. Patients may struggle to express themselves clearly. We can expect that to happen. And sometimes the providers can find it hard to maintain focus, but it's important that we walk into those rooms, into that space, and we're mindful of those emotions that are running, and we create that supportive environment that can help mitigate this barrier. Now let's turn our attention to patient-centered care, which I like to refer to as the goal. Patient-centered care is the foundational approach in modern healthcare that emphasizes putting the patient at the heart and the center of all medical decisions and interactions. So when we think about traditional healthcare models, they often revolve around the provider being the expert and directing all aspects of care. But patient-centered care shifts this dynamic. And the provider and the patient, they now work together as a team. So with the patient being an empowered participant, their unique perspectives are considered. And now we're able to tailor the care to meet their individual needs. This comes from active listening. This comes from making sure you're being empathetic and that you're absorbing as much information as possible. So at the core, it means that healthcare providers focus the preference, the needs, and the values of each individual. You're taking the time to understand what matters most to that patient, and we can do that collaboratively, respectfully, and we can personalize their care experience. That's the goal at the end of the day. This is why we practice on those essential skills of active listening, nonverbal cues. This is what we're trying to get to. We want to make sure they have a stronger voice in their healthcare journey. This is going to lead to those better clinical outcomes, improve patient satisfaction, and the adherence to treatment plans. Because now they feel heard, they're respected, and they're more likely to follow through with any type of recommendations. And they're going to feel positive about their own experience. Now, we're going to explore some key components that define patient-centered care, but it begins with focusing on the individual of that patient. Every patient is unique in their own set of concerns, conditions, lifestyles, and healthcare should reflect that individually. Share decision making, involve the patient in making their decisions, and then always respect that patient preference, values, and culture. So, what are the key elements for patient-centered care? Respect the patient's preference and needs. Acknowledge that they're different, as we just said. Our job is to listen to those preferences and adjust the care accordingly. Involve them in their decision making. They should be active about their treatment plans. For instance, explaining the benefits and risk of different options, we should ask the patient for their input, allowing them to make informed decisions and align with their values. Provide clear communication. One of the biggest barriers to patient-centered care is miscommunication. We've seen how much it can cost. It's crucial to explain things in terms that the patient can understand. Emotional support. Patients often are anxious, or uncertain, especially when we're talking about a serious illness. So, providing that emotional support by showing empathy and being available to answer questions can lead um, to less stress and make the patients feel cared for. So, we know that there are profound benefits to this type of structure. And studies have shown that patients who feel heard, respected, and involved because of the active listening and the empathy and patient communication that takes place when we create those safe spaces. So we have come to the conclusion of the presentation, but I just want to sum it up. We've talked about communication and empathy and how they're critical skills for every healthcare professional. And, these not only help us connect with our patients, but it can help our relationships with our coworkers. And of course, when we bring it back to the patient, it can significantly impact their overall care and satisfaction. So remember active listening. This allows us to fully understand our patient's concerns. And patient-centered care helps us respect their preferences and it involves them in their decision making. But this is only possible when you can communicate clearly and when they feel understood. And you want to make sure that you're building trust with your patients to create that strong foundation for a positive healthcare experience for them. Now, remember, these skills don't come overnight. It's going to take time and practice using some of those phrases and taking a moment to reflect. But by consistently focusing on empathy and clear communication, we can truly make meaningful differences in the lives of our patients and those that we interact with. So I want to conclude this presentation with a video because I think it's a great way to sum up everything that we've spoken about and really see how it plays in a healthcare setting.
Just 1 second, let me tee up the.
Mhm.
Can you all see my screen okay?
Yes.
You hear it?
I think it's on pause.
You can see it playing?
Okay, I do now. Thank you for playing that. I think the most important thing in watching that video is it proves that everybody has a story. Everybody has a unique situation that you don't know what they're facing. So it's important to lead with empathy. Always lead with empathy when you're talking with your coworkers, with the providers, with the patients. If nothing else fails, be kind, you know. So I really appreciate our time today. This does conclude the presentation, and I really hope you found it helpful. And I encourage you to apply these communications strategies and empathetic techniques in your careers. If you would like to continue the communication and dialogue, I am available for questions, and you can feel free to reach out to me at any time directly. So thank you again, and I wish you all the best in your healthcare journeys. Any questions at this time?
Thank you so much, Miss LaKishia. I know some people are dropping off, but we do have one question, and it asks, from your perspective of someone who is still practicing their communication and active listening skills, what advice do you have if after listening to what someone said to me, I'm not sure what to say immediately afterwards?
Honesty. I think I can appreciate when the provider says, I'm not sure. That to me says that you're not going to just sell me anything, that you really understand that I'm having a hard time with something and you don't know the answer to it. But promise them, ensure that you'll get back. You don't know how to feel in that moment. You don't know the answer to the question. Work on it and get back to that person. Don't just leave them hanging. That's what I would do. That's my professional experience as well.
You. And another question we have is, how would you advocate for a patient when the dynamic of the healthcare team doesn't seem to be united? So for example, a nurse might not agree with the advice of the doctor to the patient, but how do you still stay present and show the patient that you are there for them and you understand what they're going through?
Yeah, this happens a lot in any type of professional setting. A lot of times you're going to be the only person advocating. Um, I say don't stop, don't quit. If it's for the best, then that's what you do. And as far as following up with that patient, make sure they understand that, look, this is what I'm doing. Keep them involved. Keep them involved in what the status is in your application. Don't just leave them hanging. And as far as working with the team members, I think it's important to understand that when you're talking about healthcare, people have different perspectives, people have different understandings. But I think it's important to have a conversation about bringing it back to the patient and what their needs are and what their interests are. Even if what the doctor is recommending may not align with what that patient wants, it has to be understood of what the patient's values, needs, interests, and perspectives are. So make sure you bring the patient back to the center of focus when you're talking amongst the team members about that care. But it's very common to run into those disagreements, but keep advocating. Advocate for that patient.
Awesome. Thank you so much, Ms. Lakeisha. That is all the time we have for today. And I do want to thank you so much for your time, a wealth of knowledge and information that you've shared. For those who are still on the call and would like to view today's recording, as a reminder, you should receive a link to the recording within the next hour or two or by the end of today. And if you'd like to preview other past webinars, I will post the link to our YouTube channel in the chat and you can take a look at that. And if you are considering enrolling in any of our certification programs, please feel free to use the discount code webinar 400 at checkout for $400 off. I'd like to thank you all so much for joining us, and we hope to see you again soon. Thank you.